Hello, my name is Dr. Leah Hassel, and I'm a naturopathic physician practicing downtown Victoria, BC at Sage Clinic. I wanted to talk to you today about IBS, or irritable bowel syndrome, and its connection to small intestinal bacterial overgrowth, or SIBO. IBS is a huge worldwide phenomenon. It's affecting up to 60% of people. So it's definitely something worth talking about and something I am very passionate about treating. Now, most of us are familiar with the symptoms of IBS, especially if you're suffering from it. But it's not technically a diagnosis, it's just a collection of symptoms, which includes abdominal bloating, constipation or diarrhea, or a mix of both, abdominal pain, or discomfort. And these are the exact same symptoms that we find with people who have a SIBO, or small intestinal bacterial overgrowth. All that means is that there are too many bacteria in the small intestine. Normally, most of the bacteria in your gut is found in the colon, and that's totally normal. But for different reasons, the bacteria can migrate up into the small intestine where they ferment carbohydrates and produce a lot of gas. Now, this gas will expand and cause distension pains. It will cause diarrhea. It can cause flatulence. So the exciting thing for people that are suffering from IBS is that we now have a cause. Up to 60 to 70% of people that have IBS also test positive for SIBO, and we have treatment for that today. So there's other symptoms that we'll find with people that have SIBO, and those include things like acid reflux or GERD, nausea or vomiting, food sensitivities to many different foods, a hard feeling in the stomach, also called dyspepsia, excessive burping and or flatulence, mood issues, usually anxiety, sometimes depression, and definitely fatigue related to nutrient malabsorption and skin rashes. Some of the conditions that are associated with SIBO include rosacea, anemia, either low iron or B12, restless leg syndrome, prostatitis or inflammation of the prostate gland, and fibromyalgia. So in terms of testing for SIBO, what we have is a 3-hour lactulose breath test. It's essentially a non-invasive test that you can do at home over the course of 3 hours, where you breathe into tubes that are later analyzed for their hydrogen and methane content, as these are the two gases that are likely causing your symptoms if you have SIBO. So once we receive the results of your SIBO lactulose breath test, we can look at those results and see if there's an overgrowth of hydrogen, of methane, or a combination of both. And that directs our treatment. So treatment is generally 2 to 4 weeks of prescription antibiotic, herbal antimicrobial, or a combination of both, depending on your symptoms and your test results. We follow that up with a diet for 6 to 8 weeks that is very low in fermentable foods, and this helps to keep the bacterial numbers very low. I want to thank you so much for watching this video today. And if you'd like to learn more information about SIBO, you can go to www.sageclinic.com and search for SIBO, S-I-B-O. You can also email us at victoria@sageclinic.com or give us a phone call at 250-590-7809 to discuss SIBO testing and treatment.